First of all, let me get back to the rural health care. In rural health care, you know that it was 50 billion has been assigned to save them.
Mm-hmm.
First of all, how do we know that it's 50 billion? How do we know that it's not 100?
And who assigned the 50 billion? The government?
Congress, yes.
Congress.
And if you ask why 50 billion, I never heard the answer.
Mm.
Never. So that reminds me the story, like, in the morning, wife gives her husband $1 and say, please go to your work and don't limit yourself,
Mm-hmm.
We cannot, this 50 billion is drop in a bucket.
Mm.
Second, what happened with this rural or not rural hospitals even? Again, the margin is thin. The hospitals have to close because they have those peaks and valleys where they lose money. They cannot do as many surgeries as they would do if they smooth those peaks. They would not see as many patients if they would, if they do that. And how the rural hospitals react to that.
I'm going to get into the mechanism of smoothing because you keep referring to smoothing, and I don't think our viewer understands what you mean by smoothing. But let me just say this, that hospitals in the rural areas are closing their emergency rooms and their maternity. I mean, if you
Correct.
want to deliver a baby in Paducah, wherever that is, you may have to go 75 miles to deliver the baby. And if you break your arm, you may have to go 75 miles to get your arm reset. That's not very good, especially if the hospital's trying to save money by closing its emergency room and its maternity facilities. You've seen that, have you not?
Yes, absolutely. And why it's emergency department and maternity wards? Why? The reason why they are being viewed as low revenue departments.
I see.
They are not cash cows.
Yes.
So getting rid of them is like a balloon, air balloon. When it comes down, you drop the bag with the sand.
Yes.
To make it lighter. That's exactly what is going on. And the healthcare cost going up. The cost of the staff is going up. To hire nurses is more expensive than it was.
Yes.
So the hospitals are trying to minimize it, and it's no longer a healthcare issue.
Yes,
It's social and economic issue because people would have to travel where the hospital is available.